For our first question, Dr. Liquete, from your vast experience regarding organ donation, how accepted is this act among Filipinos? How has it changed from when you were a trainee to present?
It has not changed much, no, since then. It's our culture and also this family dynamics, we may have referral, yes, but it's hard to get consent from the family. Usually, the parents, the brothers, the sister would be enough, or the immediate kins. But you see, you have an extended family in the Philippines that you have to ask also the grandmother, the lolo, and your sisters or who are abroad. So it's still the same. It's still the same. You have to ask and sometimes the neighbors would have a say in the decision. So we had our organ donation law in 1991, the same time that Japan had theirs. So we are just like Japan, that it's difficult to convince the families of our donors. Unlike in Thailand or Korea, they're very much open. And even in Taiwan, very much open for organ donation, just like in the Europe and USA. So it has not changed a lot. Still the same.
Yes. So at present, the Philippines still ranks low in terms of the number of organ transplants, especially deceased organ donation that we perform here in our country.
Yes, Christine. So sad.
There are also several questions regarding the process of organ donation. So if I am a recipient waiting for liver transplant, how long is this wait?
For liver transplant, you just need the blood typing for the liver transplant. Unlike sa kidney, in kidney, you have criteria or HLA tissue typing. The point there is that the waiting list is very small, actually, 0 to 2. But then, again, if you ask the family, the consented family for organ donation, if you ask for kidney, more often they would okay with the kidney. But if you ask liver, the lungs, and all this, no, you cannot get. It's like they cannot part more with another organ na wala sa kanilang loved one. There was a time many years ago that a family consented only for one kidney. So okay, fine. One kidney would mean one patient. So we got just one. So it's difficult when you ask for another organ like the liver. So the waiting list may be small, but again, we seldom get donors Siguro for this year, I think Adi, makatatlo pa lang tayo no na donors, no?
Yes, ma'am.
Yes.
We have a very low. Maybe it's because of the effect of the COVID season.
Of the COVID. But then we may have some referrals, but sometimes these referrals are late already. No, they're not fit to donate anymore, number one. Number two, when we test them for COVID, they're positive. No? Number three, the family would not consent. So these are some limitations that we have to fight against. Yes.
Okay.
world moves in real time. So should our healthcare technology. With information needed, decisions to make, and experience to share. Every second counts. Live integrated tele-ultrasound enables real-time communication, remote collaboration, confidence, knowledge, and learning. The first ever integrated tele-ultrasound collaborative platform. Philips Lumify. Integrated tele-ultrasound powered by React's collaborative platform. Innovation and you. Philips.
So for a person who died of brain aneurysm, so this is brain death, when is the best time for organ retrieval? How long is the organ viable?
Brain aneurysm, and then the patient becomes brain dead, right? The patient should be stable enough so that we have a very good perfusion to the vital organs. Mga vascularized organs yan. For cornea, it doesn't matter. Maski na post-mortem na kunin. But for vascularized organs, the donor should be stable. As I have mentioned there, no, mga vital signs niya and all. So that when you retrieve the organs, they are still functioning. That's the best time, I believe so. And as to the storage, it can be cold storage, as mentioned by Dr. Aparino, or using the machine perfusion. For how long? Adi nga, can you expound on for how long,
Yeah, how
especially
long?
if we use the machine perfusion?
Yeah, for recommendation for the cold storage, ma'am, as of now, if your projected transplantation can be done less than 20 hours, we can do with the cold storage or cold static storage. But if there's variability on when you can transplant or hindi alam kung kailan matatransplant, natatagal for some reason for cross-matching or finding a good recipient, it would be advisable to store the kidney with the machine perfusion machine. We have kidneys who remain viable up to 45 hours after storage. So yung storage is increased with the machine perfusion.
I think it answered the question. So it's not just the time, but actually it's the process of organ. There's a process like identifying the possible organ donors, the early, as Dr. mentioned, early referral, and then afterwards, brain death determination. So for possible donors. And then afterwards, mobilizing the transplant team. And yun, as you mentioned, yung undergoing the donor selection, donor management, mobilizing the transplant team until the organ is harvested and then transplanted to the recipient, and also post-operative care.
Christine, I think it's worth mentioning, no, that the recipient should also be ready at any time.
Yes.
Because the waiting would be longer if we are to have these recipients waiting on the list, but then they are not worked up, they're not really cleared for surgery yet. You spend more time in working them up. So every time that when we have patients who want to be enlisted in the cadaver program, they should be worked up, at least some basic workup before they are enlisted, so that when they are called, they're almost ready, or at least some things to be repeated. Otherwise, they should always be ready. Otherwise, they will be skipped along the line.
Yeah.
Yes.
All right.
That's right.
That's good to know, Doctora. So, dami lang kailangan i-consider.
Mhm.
May I ask for clarification regarding warm ischemia time and cold ischemia?
Yes, for living donation, actually the cold ischemia time is irrelevant kasi pagkakuha sa donor, ini-implant ka agad.
Mhm.
What I mean by warm ischemia time is the time from clumping of the vessels, bali yung wala na yung blood flow sa organ, hanggang malagay sa cold bath. Yung cold ischemia time is from the time na nalagay sa storage up to the time na ma-implant. Cold ischemia time is very relevant for cadaveric donation
For
kasi we
cadaveric
store the kidneys in cold storage. The shorter the ischemia time, the successful the transplant would be.
Okay, thank you, Dr. Paraina, for the clarification. Do we test compatibility for deceased donors?
Yes, Doc. Tissue cross match.
Okay.
Yes.
So as you mentioned earlier, Dr. HLA, HLA typing.
HLA, tissue typing, and then cross match. That's more important. For the liver, mas kinaano lamang yun, blood typing lamang.
Blood typing.
Sometimes we do not do actually cross-matching for the liver. A liver is less immunogenic than the kidney. But the surgery of liver transplant is more complicated than the kidney.
Allocation of the organs being retrieved for organ donation from deceased donor is being done by a separate entity of DOH, which is PhilNOS. At PhilNOS, there's a scoring system. So hindi unahan sa pag-enlist yan. It's more of point system. The more matches you have with the donor, the more chances of you being allocated. So swertihan lang talaga because of the point system. It's not first come first serve basis.
All right. So there's also a wait list, and also there's an what do you call that? A scoring allocation system. The scoring kung sinong mas ka-match nung potential donor. All
Yes.
right. Yeah. So pwede po bang mag-donate yung under VA ECMO?
This patient on VA ECMO has maybe may pulmonary problem also.
Yes. I think
Ang indication
very
kasi ng
sick.
very sick na yun siya. Oo. Hindi na yun pwede, especially mga organs niya affected na. Multi-organ failure na siguro yun. But I would like to mention that in some instances, yung mga rich country na siguro to, if they want to maintain the cadaver for a long time, they can maintain the pressures and all with an ECMO machine. But that would be very expensive.
Very expensive.
Hindi pwede sa atin yun.
How are the donors' families compensated for deceased organ donors?
Before we have funeral assistance, it's not given as a cash, but instead we arrange for a funeraria, we arrange for transfer of the body to Cebu if they want to transfer the body to Cebu or to where else in the Philippines. But later on, it's so complicated, engaging a funeral parlor and all this and then this transport. So it was fixed to some amount, and that is for funeral assistance. It's not really a compensation, it's funeral assistance.